This is a very interesting presentation. I would like to move with my presentation. I would like to say my special thanks to the IPSA company for inviting me to speak about the role of glycosamine therapy as an alternative to antibiotic for the management of and the prevention of recurrent UTI. I have no disclosure statement. I have no disclosures to discuss. This is my agenda for today. Firstly, I would like to discuss with you the management of cystitis in the era of antimicrobial crisis, as Professor Gernot clearly highlighted. Moreover, I would like to discuss with you the importance of the role of antibiotic-sparing approach in uncomplicated UTI, and in particular in the management of recurrent UTI. Finally, I would like to discuss with you the pivotal role of glycosamine therapy for improving our antimicrobial stewardship adherence in everyday clinical practice. And the most important aim for today is convince you that I'm right, of course. So I would like to start with a question for you. The question is why I will still talking about antimicrobial treatment in the management of uncomplicated UTI 80 years after the discovery of penicillin. This is a very important question to do. I think that in the 80s we were happy under the protection of antibiotics, but now what's happened? Bacterial resistance destroy our protection. Bacterial resistance destroy antibiotics. And the question is, how we can overcome the problem? What we do? The first solution could be find a new umbrella, but as you will know, the number of new antimicrobial drug approval is decreasing in the last year, as the number of new antibiotics in the company pipeline is very low. The second solution could be the change our point of view. I think that this is a very important aspect to highlight. We need to change our point of view because the medicine change, the patient change too, and also the bacterial change. As you will know, the prevalence of resistance to fluoroquinolone, a broad-spectrum antibiotics in gram-negative uropathogen is increasing, as clearly Gernot demonstrated. A new approach is urgently required. Our guideline, as reported by Gernot, suggests to inquire about our local bacterial resistance, suggests to perform a correct assessment of all patients related and all bacterial-related risk factors before prescribing antibiotics. Moreover, our guideline suggests to know the exact pharmacological and pharmacokinetics characteristics of antibiotics that we want to use if indicated. But the most important aspect to highlight is that our guideline suggests to avoid the overuse of antibiotics. Even if our guideline clearly suggests some steps to perform in everyday clinical practice, we have a lot of gray zone to take into account. First of all, antibiotic treatment is able to eradicate bacteria, of course, but is not able to prevent recurrence. Another important green zone is the fact that antibiotic treatment can lead to long-term impairment of the normal microbiota of the vaginal and bowel tract, and the antibiotic treatment is associated with the development of multi-drug resistant microorganisms. But what is the patient's point of view about the recurrent UTI? In not yet our published study, we demonstrated that the recurrent UTI is associated with a higher level of stress and anxiety in a woman affected by recurrent UTI when compared to sporadic UTI. And the impairment of quality of life in this kind of patient is very high. Moreover, in the same article, in the same paper, we stress the fact that a prompt diagnosis, risk factor identification And early management is essential in order to reduce the number of symptomatic episodes, to reduce the level of stress and anxiety, and improve patients' quality of life. And moreover, it's very important to highlight that in early management is able to decrease the number of unnecessary antibiotics and improve our adherence to antimicrobial stewardship. But what does it mean, early management? Several years ago, we developed a simple tool to use in everyday clinical practice in order to predict the recurrence risk in women with a symptomatic urinary tract infection. In particular, we focused our attention on the woman with recurrent UTI. According to our nomogram results, we stratified all women enrolled in our study into 3 groups: the low risk of new recurrent episode, symptomatic episode, a moderate risk group, and the high risk group. On the basis of our nomogram results, we suggest to perform an active prophylaxis in all patients in a high risk group. But what does it mean, active prophylaxis? Several years ago, we stated that a tailored approach according to the patient's risk factor and bacterial characteristic is a promising option also in the prescription of antimicrobial sparing approach to recurrent UTI. I would like to ask you to avoid to prescribe antibiotic in recurrent UTI prophylaxis, because the use of antibiotic as a prophylaxis in recurrent UTI is associated with the antimicrobial resistance, of course, adverse effects, recurrence, and development of multi-drug resistance strains. On the basis of this consideration, it is important to focus our attention on the relationship between bacteria and the host. This is the good strategy to improve our adherence to the guideline, of course, but it is also important to increase the patient's quality of life and improve our adherence to antimicrobial stewardship principle. As you all know, as Gernot clearly stated that blood epithelium is protected by a glycosaminoglycan, a 2 protein characterized by the presence of hyaluronic acid and chondroitin sulfate. This is a very important paper published 2 years ago in the PLOS ONE journal. In the case of absence of glycosaminoglycan layer, E. coli is able to attack urothelial cells, destroy the urothelial cells, and here you are, the symptoms. This is a very simple physiopathologic example of the acute UTI. But moving to the core of my presentation, I would like to discuss with you some interesting results about the use of hyaluril, the hyaluronic acid and chondroitin sulfate preparation for the endovesical instillation that has been published from several years ago. First of all, I would like to remember you the first study of Damien Rocco Damiano and co-workers from Italy. They demonstrated that the use of hyaluril drug is able to reduce the rate of urinary tract infection and improve the patient's quality of life. The same results has been obtained also by the study from Vita and co-worker. Moreover, another important aspect to highlight is that the use of hyaluril is associated with the reduce of UTI recurrence, reduce the use of antibiotics. In other words, the use of hyaluril is associated with an improvement of our adherence in antimicrobial stewardship in everyday clinical practice. Moreover, Other paper from Chani and co-workers published a few years ago in the medical journal Open demonstrated that the hyaluryl drug hyaluryl instillation is associated with the reduced number of UTI, and in particular, the hyaluryl is able to reduce the risk of recurrence. In other words, the hyaluryl is able to reduce the patient's anxiety and stress and improve the patient's quality of life. But another important aspect to highlight in order to plan our approach to recurrent UTI is to highlight that hyaluryl therapy is associated with a long-term efficacy, improved quality of life, reduction of nursing on visit, and the most important, reduce of antimicrobial use. This is a very important slide to take in mind. Another demonstration, another endoscopic demonstration of the efficacy of hyaluryl instillation has been demonstrated a few years ago by Elisabetta Costantini from Perugia. They demonstrated that hyaluryl is able to repair the normal urothelium and create a new barrier against the bacteria, So, moving to the conclusion, I would like to show you as the presence of glycosamine glycan is able to avoid the attack of E. coli to the urothelial cells, and the therapy with the hyaluryl, the presence of glycosamine glycan is able to improve the patient's quality of life, and here the patient is happy. In conclusion, I would like to suggest to you to keep in mind that the glycosamine glycan therapy, hyaluryl therapy, is safe and useful in the management of patients with a recurrent UTI. Glycosamine glycan therapy is able to improve patients' quality of life. Moreover, the therapy with the glycosamine glycan is able to decrease the number of repeat UTI episodes. And the most important aspect to highlight is that the glycosamine glycan therapy is able to improve our adherence to antimicrobial stewardship program. Many thanks for your attention.